and welcome to the Hubmed Ed podcast, your trusted source for global insights in aesthetic medicine. I'm your host, Yesel Martinez, and today I'm thrilled to welcome a very special guest, Dr. Kyung Tae Bae. Dr. Bae, welcome.
Hello, nice to meet you.
Dr. Bae is an internationally recognized expert in aesthetic medicine, both at clinical practice and education across Asia. Today, we're going to explore with him aesthetic medicine and Asiatic perspective. We are going to look into cultural nuances, trends, patient expectations, and innovations shaping the field in Asia. So, Dr. Bai, could you share a little bit about your journey in aesthetic medicine? What inspired you to specialize in this field?
Thank you. First of all, thank you, Isabel. It's a real pleasure to be here. My journey into aesthetic medicine actually started with the fascination for how medicine could improve not only health, but also confidence and quality of life. I studied medicine in Korea, and during my early career, I worked in both general practice and dermatology settings. What inspired me most was seeing patients transform, not only in their appearance, but also in their self esteem after treatments. That made me realize aesthetic medicine was more than just procedures. It was about restoring harmony and well being. Over the years, I had the privilege of training and collaborating with colleagues across Asia and internationally. This exposure shaped my philosophy, blending scientific precision with cultural sensitivity, always tailoring treatments to the unique needs of each patient.
That's absolutely fascinating. You grew a lot in very short time, so you became a strong expert in the field. In your expert opinion, how aesthetics is viewed differently from Asia compared to the West?
When we talk about Asiatic perspective, the first thing that comes to mind is cultural diversity. Beauty ideals are not only universal, they vary significantly across regions. For example, in Korea, patients often emphasize skin clarity, elasticity, and a natural, youthful look. In China, facial balance and refinement of features such as the nose or jawline are more prioritized. In Southeast Asia, brightening and over rejuvenation treatments are very popular due to sun exposure and pigmentation concerns. What unites these regions is the preference for natural yet noticeable improvements. Patients in Asia usually don't want to look dramatically changed. Well, I think this is worldwide trends these days, but Asia, and especially Asia, they care about it more.
Go now to see how many how these preferences influence the techniques and technologies adopted by practitioners in Asia.
This directly influences how practitioners adapt global techniques. For example, filler injection styles in Asia often focus on structure and contour enhancement with minimal volume, while energy-based devices like HIFU or RF are widely used for lifting and skin tightening. In short, treatments are always tailored to cultural expectation of beauty.
So if we want to say something amazingly outstanding, is that the aesthetic medicine in sorry, know about aesthetic medicine in Asia is highly innovative and fast moving. What are some of the most exciting innovations or techniques that you are see happening right now in the area, Dr. Bai?
Asia is an incredibly dynamic market for aesthetic innovation. I would say three main areas are leading the change. First, non-invasive and minimally invasive treatments. Patients here want effective results, but also quick recovery to fit busy lifestyles and return to their usual lifestyles. And second, there are so many manufacturers in Asia, especially in Korea. That's why treatment have advanced significantly in Korea from energy-based devices to injectables, such as needle RF, polynucleotides, and polymers. These products don't just fill, they stimulate regeneration, which is very aligned with the Asian preference or worldwide preference for natural and long term improvements. Third, the integration of technology. We now use AI and advanced imaging for facial analysis, treatment planning, and patient education. This not only enhanced precision, but also built trust because patients can visualize outcomes before committing to a procedure.
How do you think these innovations are likely to shape the global practice of aesthetics in the years to come?
I believe these innovations will influence global practice. In fact, many Western practitioners are already adopting techniques and products that were first popularized in Asia or Korea.
And being up to date is not easy at all. We know that doctors have their agendas always full, and well, they have very short time for training and education. And we all know in this topic, education is key. How important do you think is continuous learning for practitioners in this field, especially given how quickly trends evolve in the sector?
Well, continuous learning is absolutely essential in these fields, especially for the doctors or practitioners worldwide. Aesthetic medicine evolves so quickly. New products, new devices, new techniques appears every year. Well, I think every month. In Asia, there is a strong culture of education. Practitioners regularly attend workshops, conferences, and hands on training. There are so many conferences in Korea or in Asia, like Bangkok. So the collaboration is the key. We share not only successes, but also complications and how to manage them. International exchange is equally important. By learning from colleagues in Europe, the US, and Latin America, and sharing our own innovations, we all raise the standards of care. To practitioners, my advice is very simple. Never stop being a student, be curious, stay humble, and always prioritize patient safety over trends. Mastering fundamentals while staying open to innovation is the best way to grow.
Actually, you read my mind because the next question I had in mind was what would be the advice that you would give them? But yeah, I mean, you made it clear they actually need to go on learning, go on preparing, go on growing to always be able to, yeah, satisfy any patient's request, demand, and so on. So, yeah, thank you for reading my mind. And let's look ahead, Dr. Bae. What's your vision for the future of aesthetic medicine in Asia and globally?
Looking ahead, my vision for aesthetic medicine in Asia is one of balance, combining advanced science with artistry, personalization, and ethics. Globally, I believe we'll move toward regenerative aesthetics, treatments that don't just change appearance, but also it improves skin health and slow aging at the biological level. This is a very exciting time to be in our field.
Well, Dr. Bae, thank you so much for joining us today and sharing your insights on the Asiatic perspective. It has been a privilege and a pleasure to hear your perspective on aesthetics medicine and the innovations shaping the field in Asia. Thank you.
Thank you so much, Jezebel. And thank you to Hubmed Ed for inviting me. It has been a privilege to share my thoughts. I hope today's podcast helps more practitioners appreciate the diversity and innovation happening in Asia. I truly believe that by learning from each other, we can build a more connected and patient centered future in aesthetic medicine. Thank you again, and I look forward to sharing my thoughts and practice with Hubmed Ed. Let's keep in touch and continue this global conversation.
Thanks a lot, Dr. Bai. And to our listeners, if you enjoyed today's conversation, don't forget to subscribe to the Hubmed podcast for more expert-led discussions on aesthetic medicine from around the world. You can also find exclusive courses, webinars, and training opportunities on our platform at www.hubmed.com. I am Jezebel Martinez, and this has been October's Hubmed Ed podcast, where knowledge meets innovation in aesthetic medicine. See you soon.